Parkinson's disease is a neurodegenerative disorder that can negatively impact both motor and non-motor skills.
Parkinson's disease is mainly recognized by the motor symptoms and signs, but there's actually a very large number of non-motor symptoms that can occur in people who have Parkinson's disease.
But a recent Parkinson's research discovery is a real game changer.
Parkinson's disease traditionally has been diagnosed based on clinical evaluation. That's been shown to only be about 70% accurate. So having something that's 90% accurate, that's a biomarker test from spinal fluid, is really astounding, and it's a real improvement to the current state of clinical care.
Discover the Parkinson's disease biomarker breakthrough inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. Parkinson's disease is a progressive disorder impacting the body's nervous system, commonly resulting in tremors, slowing of movement, muscle rigidity, even affecting a person's speech. What causes Parkinson's disease? How common is it? And how is it treated? To gain insight, we spoke with an expert. Dr. Eric Jakowiak is an assistant professor of neurology and a Parkinson's disease and movement disorder specialist at Froedtert and the Medical College of Wisconsin. He also has an appointment at the Zablocki VA Medical Center, where he's director of the site's National Parkinson's Disease Consortium Center. Dr. Jakowiak first tells us Parkinson's disease is
a neurodegenerative disorder. So what that means is there is damage or loss in certain brain cells. This does get worse over time, and what that results in is a progressive decline or impairment in both motor and non-motor neurological functions.
When was Parkinson's disease first diagnosed or recognized? Dr. Jakowiak says it's older than you might think.
There's actually reports, even going back to ancient China, ancient India, where some aspects of the disease have been described. But the first real medical literature in which this was described was in the early 1800s. James Parkinson wrote a very famous essay called An Essay on the Shaking Palsy. He did this after observing people that he saw on the streets of London, kind of grouped similar tremor and movements together and described this condition.
Soon, others pursued Dr. Parkinson's discovery.
Over the next several decades, it was defined further and studied further, and it was another famous neurologist, Charcot, who later gave it the name of Parkinson's disease in honor of James Parkinson's essay earlier in that century.
How common is Parkinson's disease today?
Parkinson's is extremely common. Among the neurodegenerative disorders, it's ranked number 2, second only to Alzheimer's disease in terms of how many people have this condition.
So, how many people do have Parkinson's disease?
It is more likely to occur as people get older. Over the age of 60, it's actually 1% of people in that age group are affected. So if you can imagine, that's a very large number of people.
And among people of all ages, both across the U.S. and here in Wisconsin.
In the United States alone, estimated that's about 1 million people. That number is expected to increase even up to 1.2 million by 2030. And then in Wisconsin itself, there's probably about 15,000 people with Parkinson's disease.
As he mentioned, Parkinson's disease can affect both a person's motor skills and non-motor skills as well.
Parkinson's disease is mainly recognized by the motor symptoms and signs, and that's really how we define it clinically as well. But there's actually a very large number of non-motor symptoms that can occur in people who have Parkinson's disease.
Dr. Jakowiak shares what some of these signs are, beginning with the motor skill symptoms.
Among the motor symptoms, Parkinson's causes slower movements, smaller movements. Besides the slower movements, other things can include something that we call rigidity. Basically, what this means is muscle stiffness and tremor.
But although it is indeed a common symptom associated with the disease,
not everyone does have the tremor. If it is there, it commonly involves the limbs, the hand or the foot, might even involve things like the chin or jaw too. And when it's in the hands or the legs, it's most commonly there at rest, so meaning when you're not using the hand and it's just, say, sitting in your lap. That's different from other types of conditions that also cause tremor.
What about involuntary movements, like those displayed by perhaps the world's most famous Parkinson's disease patient, actor Michael J. Fox?
A lot of people that I talk to, when they think about Parkinson's disease, immediately the person they think about is Michael J. Fox. So what they imagine are these more uncontrollable, extra fidgety type of movements. And actually, Parkinson's disease itself does the opposite. From a motor perspective, Parkinson's causes slower movements, smaller movements, and those extra movements that you see with Michael J. Fox are actually a side effect of treatment.
We'll learn about treatments and hear from someone with the Michael J. Fox Foundation in a bit. What about the non-motor skill symptoms?
On the non-motor side, basically this can affect every system in the body, unfortunately. So there's a large number of different symptoms that can happen. These are highly variable, so not everyone with Parkinson's will experience all of these. And it does vary somewhat depending on how long you've had Parkinson's. There are even some symptoms that can occur years or even decades before things like tremor or slowness of movement start.
Non-motor symptoms such as
loss of sense of smell, constipation, or starting to act out dreams when you're sleeping. Other impairments of sleeping, insomnia, tendency for the blood pressure to start running lower, or that it drops too low when you stand up quickly, where you might get lightheaded or dizzy. Bladder changes, overactive bladder, so out of urgency or frequency, and then even changes in mood or anxiety.
And in cases of more advanced Parkinson's disease,
unfortunately, there is a risk for more significant changes in cognition or memory that could cause dementia, or even hallucinations can occur in that stage also.
When someone begins displaying motor or non-motor skill symptoms, how are they tested to confirm a diagnosis?
Diagnosis of Parkinson's is clinical, and what we mean by that is that you can make the diagnosis just by listening to a person's story of what their symptoms are and doing a physical exam. So that's actually all that you need to make a diagnosis of Parkinson's disease.
Now, I know what you're probably thinking, and yeah,
there is a chance that you can actually be wrong. Symptoms are mild, etc. And so, really the main thing that helps to kind of rule in the diagnosis is watching it over time, making sure the symptoms continue to act like Parkinson's disease and not like something else, or even the response to treatment. So if there's improvement with medications we have to treat Parkinson's, that's highly supportive of the diagnosis.
He says there are some tests available.
Early on, testing might include some things to even just rule out other conditions. So say someone might get an MRI of their brain, but really that should be normal in Parkinson's. It's primarily to rule out other things. That being said, there are some other tests that can be done. There is a nuclear medicine test called a DAT scan using imaging techniques to look for degeneration in the brain cells that we know are affected in Parkinson's disease.
And there are other tests.
These are newer and not as commonly used clinically. One is actually a skin biopsy. It's looking for a certain protein that accumulates in body tissues and in the brain in people with Parkinson's disease. And then there's a similar type of test in the spinal fluid. Not really done commercially now, more just on a research basis.
As a progressive disease, how are different stages of Parkinson's defined?
One staging system system that is most commonly used is called the Hoehn-Yahr staging system. Kind of just ranks numerically 0 through 5, the lower numbers being the earlier stages and later numbers being the later stages of Parkinson's.
But Dr. Jakowiak says the Hoehn-Yahr staging scale has some shortcomings. Specifically,
it's not actually very good at telling a person how the symptoms are actually affecting their day-to-day life on a more individualized setting. The other thing that's not very good about it is that people tend to spend a large amount of their disease course in stages 2 and 3. And so it doesn't really predict time course-wise how people progress through those stages.
Which is why, instead,
I kind of use more general terms, saying earlier stage or middle, moderate stage or advanced stage. And there are certain characteristics or features, both from a motor and non-motor perspective, that might go with each one of those stages.
What about common treatments for Parkinson's disease? Dr. Jakowiak puts them in 2 categories.
Treatments for the motor symptoms and treatments for the non-motor. From the motor perspective, the main thing that we are trying to do is replace the chemical called dopamine in the brain. This chemical is essential in movement. As there is less natural dopamine around in the brain, our main way of treating that is giving the brain dopamine in the form of a medication called carbidopa/levodopa.
And while it's not a new drug,
it's considered the gold standard, and it's an old treatment. It's been around for a long, long time. Despite that being a very old medicine, it's still the best treatment that we have for Parkinson's.
There are other pharmacological treatments.
These other medicines are commonly used as added medicines to the carbidopa/levodopa. Commonly, it is because as Parkinson's progresses, the brain just needs more and more dopamine, and the dopamine that we give it in the form of a pill may not last as long, and so we might use combinations of medications for that reason.
As far as non-pharmacological treatments,
there are surgical treatments. You can give the dopamine directly into the intestine through a pump that you would wear. There's also a brain surgery called deep brain stimulation, putting an electrode into the brain and stimulate the parts of the brain that are affected in Parkinson's disease. It kind of simulates what the medication is doing, but it does it on a more consistent basis. So that is another thing that can be used as they're reaching complications of treatment with medications.
And some of the most important treatments aren't medicines or procedures, but
physical activity and exercise and physical therapy, occupational therapy, speech therapy. There's actually a ton of growing data in clinical studies over time that really show clear benefit of exercise and physical activity in people with Parkinson's disease, even to the point where there is some chance that it might even be slowing disease progression or changing the way that the brain functions in the disease.
While very treatable, Parkinson's disease is not curable.
We unfortunately do not have anything that we know clearly stops the progression or slows the progression of the disease. However, there are definitely things that we can do to improve symptoms and improve quality of life.
So for now, the good news is,
among neurodegenerative disorders, it is probably the one that is the most likely to improve with treatment.
Which is something he and his cohorts of the Parkinson's and Movement Disorder Program at Frederick Medical College of Wisconsin focus on daily.
Our whole aim and goal is improving quality of life in people with Parkinson's disease.
It's a multidisciplinary team consisting of
neurologists who have specialty training in Parkinson's and movement disorders, neurosurgeons, nurse practitioners, physical therapists, occupational therapists, speech therapists, neuropsychologists, nursing staff, all who have a lot of expertise in Parkinson's. And I do want to highlight that our program recently given the designation of a Parkinson's Foundation Comprehensive Care Center, a huge honor for our program and a testament to the work that's being done in our department.
Is there research being done at MCW related to Parkinson's disease?
We do have a number of different studies going on. We are a site for a national genetic testing registry, actually through the Parkinson's Foundation. Another thing we have going on is learning more about speech and swallowing function in people with Parkinson's. And then on the medication end, have a large number of clinical trials that come and go throughout our program over time as well.
There's a lot of information about Parkinson's disease available. Dr. Jakowiak just cautions us.
Just like anything else, there's a lot of good information on the internet and there's a lot of bad information on the internet. Particularly with Parkinson's disease, a lot of misinformation out there and some things that are flat out wrong, or maybe that there are things that we used to believe to be the case, but that has changed over time as science does.
So, for reliable information,
the Michael J. Fox Foundation is a really good resource, as is the Parkinson's Foundation. Locally, the Wisconsin Parkinson Association, they have a lot of information and resources, support groups and exercise classes and those kind of things.
Finally, Dr. Jakowiak says he's cautiously optimistic that a cure for Parkinson's is in our future.
We've been studying this for a long, long time and have not found it yet. However, the flip side of that is because we've been studying it for so long, the amount of scientific information that has been gained over time is massive. It's cautiously optimistic in that we can always hold out hope. One of these treatments will show that cure.
Next, we discover a research breakthrough creating a new pathway that, dare we say, could perhaps one day bring an end to Parkinson's disease altogether. For this, we spoke with Dr. Samantha Hutton, a staff scientist and director of the Discovery and Translational Research Team at the Michael J. Fox Foundation for Parkinson's Disease Research.
The Michael J. Fox Foundation was founded in 2000 with just one goal. We wanted to find a cure for Parkinson's, shut our doors, and go out of business. So we were founded by a person living with Parkinson's. People and families living with the disease are really at the center of everything we do. We're the largest nonprofit funder of Parkinson's disease research in the world, and to date we've funded more than $2 billion in research, not only in the U.S. but globally.
Of all the monumental work the Michael J. Fox Foundation has done, perhaps the most impactful to date is its Parkinson's Progression Markers Initiative, or PPMI.
PPMI was launched in 2010. We've actually invested over $500 million in this study to date, which is amazing. And the goal of PPMI is to identify biomarkers for Parkinson's disease.
Dr. Hutton reminds us what biomarkers are and why they're important.
Biomarkers are things that we can measure in our body that tell us something about disease. Things like cholesterol for heart disease or A1C levels for diabetes. These are definitive tests, and they tell us whether or not we have a disease. Biomarkers are critical, not just for patients because they enable diagnosis and disease monitoring, but also for clinical trials because they tell us whether or not drugs are working. They help us make sure we're enrolling the right people to test these drugs, and that makes clinical trials successful, which is what we want.
But for Parkinson's disease,
unfortunately, to date, we haven't had an accurate, reliable biomarker, something that can tell us definitively whether someone has the disease or not, or how it's progressing.
As a biomarker study, the PPMI was designed to change that.
And it's been going on for 14 years now, and it has over 2,500 participants enrolled. This includes people who are newly diagnosed with Parkinson's, people who have a family connection, people who have loss of sense of smell, which is called hyposmia, or sleep disorders like REM sleep behavior disorder, because these are thought to be risk factors for Parkinson's disease. And we also have healthy volunteers.
The study is ongoing and still enrolling participants.
It's still open, and we still need volunteers to help identify these Parkinson's disease biomarkers.
What exactly does participating in this large-scale longitudinal study involve?
The people who participate in the PPMI study, they come to one of the 51 sites that are around the globe. They come visit us every year, and they participate in clinical tests, brain scans, and biosample collections like giving blood and spinal fluid. And the goal of all this is to really fuel biomarker research for patients and clinical trials.
And late last year, the PPMI study achieved a landmark research breakthrough, the discovery of alpha-synuclein, also being called the Parkinson's protein.
Alpha-synuclein is a protein, and it's found all over our body. We don't know exactly what it does, but it's meant to be there, and it's something that performs functions in brain cells.
However, in people with Parkinson's disease,
for research reasons we don't completely understand yet, alpha-synuclein clumps up. Everybody with Parkinson's disease has clumps of alpha-synuclein in their brain, and this is in fact a pathological hallmark of the disease. We know about this alpha-synuclein clumping based on autopsy data in brains of people who are deceased that have Parkinson's disease, but to date, we've never been able to visualize it through imaging studies or to measure its clumping in the brain of living people.
That is, until now. And what a game changer this biomarker discovery is, leading to a new assay or measurement tool.
It's called the alpha-synuclein seed amplification assay, SAA for short. But SAA is a test that can detect pathological alpha-synuclein in spinal fluid of people with Parkinson's disease. And like I said, this is the first time we've ever been able to measure alpha-synuclein and its pathological forms in living people.
How does the alpha-synuclein seeding amplification assay work?
Essentially, the way it works is a doctor will take a small amount of spinal fluid from a patient and send it to a lab where the scientists can add a man-made synthetic alpha-synuclein into a test tube. In Parkinson's disease spinal fluid, the spinal fluid that's been collected from people that have the disease, that alpha-synuclein that's added to the test tube clumps and clumps and clumps, and these clumps are tagged to a fluorescent dye that we can detect with a special machine.
But in the absence of Parkinson's disease,
when you add this man-made alpha-synuclein to the test tube, you don't get any clumping, there's no fluorescence, and you don't detect anything. But in people who have Parkinson's disease, when that man-made alpha-synuclein sees their spinal fluid, it clumps up, it casts a bright light with this fluorescent dye, and that's what you can measure in the machine with the test, and that's how it works. It's really cool.
that is really cool. Can this assay both detect Parkinson's already present, as well as indicate increased potential for development of the disease in not yet diagnosed patients?
Yes, the assay can confirm the presence of abnormal alpha-synuclein in people with Parkinson's disease, but it can also identify people who are at risk for developing Parkinson's. And there are a few risk factors that increase the likelihood that someone might go on to develop Parkinson's disease or another synuclein-related disorder. And these are loss of smell and sleep disorders like REM sleep behavior disorder. So we're actually recruiting people with those problems into PPMI so that we can monitor them over the years and see if they develop Parkinson's disease.
And with this biomarker in their spinal fluid,
we know that people who are at risk, those who have shown to go on to later develop Parkinson's, also have a positive SAA test, which is really exciting because it gives us this opportunity to be able to measure a biomarker in people that don't even have the disease yet.
Meanwhile, in cases where Parkinson's disease is present, the assay detects it with amazing accuracy.
And it actually does this with over 90% accuracy, which is pretty outstanding diagnostic accuracy.
Is it common for tests of neurological disorders to perform at 90% accuracy?
Before the development of this biomarker test, Parkinson's disease traditionally has been diagnosed based on clinical evaluation. That's been shown to only be about 70% accurate. So having something that's 90% accurate, that's a biomarker test from spinal fluid that has that level of accuracy is really astounding, and it's a real improvement to the current state of clinical care.
But Dr. Hutton likes to keep things real by recognizing some of the assay's current limitations.
We're really excited about this biomarker breakthrough, but there's more work to do here. So there are some limitations. This is not going to be a biomarker that you can get in your doctor's office tomorrow, and there's reasons for that.
One current limitation of the test is that
it can detect alpha-synuclein in the spinal fluid, but it's a yes or no answer, so it's not quantitative. If you think about cholesterol measures, you get a blood test, and if your cholesterol level's over a certain amount, that's a red flag that you have high cholesterol and maybe you need some treatment. We don't have that right now for the SAA assay. Right now, it's do you have alpha-synuclein clumps or not? What we need to get to is a measure of your alpha-synuclein clump and a threshold or a cutoff that we can say above this level you have Parkinson's and below this level you don't have Parkinson's.
having quantitative, measurable numbers will help propel
diagnosing and being able to enroll for clinical trials, but it'll also help us track disease progression.
The Michael J. Fox Foundation is also working hard to
transform the assay from a spinal fluid test to a blood test. We're so thankful to all the participants in research studies and clinical trials who give their spinal fluid because not everybody everybody likes to have a spinal tap. So what we really want to do is find a less invasive way to measure this alpha-synuclein FAA assay. So we're looking at things like blood, nasal swabs, urine, and make it more accessible to patients who want to have this test and make it a little bit easier.
Through ongoing research, the PPMI's biomarker discovery means speeding up Parkinson's disease diagnoses.
We hear these stories of patients who go to doctor after doctor. It takes them several years from the time that their symptoms first start until they have diagnosis, and that's awful.
Improving clinical trials.
We know that companies are starting to use this biomarker as an enrollment criteria in their trials. That means that they're enrolling subjects into their trials that are positive for this biomarker, which ensures that the people who are recruited in trials that are happening right now actually have Parkinson's. And that sounds obvious, but without a biomarker to be able to enroll those patients, we don't really know whether the drugs to date haven't been working or the right people haven't been enrolled in the trial. So having this biomarker is setting them up for success.
And because of its high level of accuracy in detecting the disease,
it's also paving the way for prevention trials. This is huge. This means that in the near future, we'll be able to use this biomarker test to identify people that we should enroll in drug trials even before they have Parkinson's, stopping the disease in its tracks before the dopaminergic neurons are dying in the brain and before the alpha-synuclein is pumping up in the brain and kind of messing everything up.
The alpha-synuclein biomarker is also helping identify molecular subtypes of Parkinson's disease, paving the way for a
more precision medicine approach to treating Parkinson's and helping us to make sure people are getting the right treatment based on the type of disease they have.
The significance of the PPMI's discovery and its impact going forward cannot be overstated.
I think this is really huge. To be able to detect pathological alpha-synuclein in the human brain for the first time in living patients is transformative. And I would say kind of the tip of the iceberg, now that we have this biomarker, it kind of opens up the door being able to measure alpha-synuclein and figure out what's happening biologically, molecularly. I think it's really going to change how we do research and design our clinical trials.
And perhaps nobody is more excited than the Foundation's namesake, Michael J. Fox.
You know, Michael is so humble and he's so gracious. When our team told him the good news, it was on the computer, and he literally picked up the computer and he hugged it. It was so sweet. He calls this biomarker breakthrough the big reward, the big trophy. And I've also heard him countless times express his heartfelt gratitude to patients and their families and the researchers. He's just really excited and thankful for all of the work that's gone into this across the board.
So, could this mean an end to Parkinson's disease in our future?
I think so. I think not only can we end Parkinson's, we can make sure that nobody gets Parkinson's. We're not there yet, but this biomarker is paving the way for that. So this is a first step in that process, and this is so huge.
To learn about the Michael J. Fox Foundation, the PPMI, and more,
check out our website, which is michaeljfox.org. And then related to PPMI, if you want more information about that study, you can go to michaeljfox.org/PPMI.
Dr. Hutton says the future of Parkinson's research looks bright.
This biomarker is moving us forward. This is going to transform patient care, and it's going to propel us into a new era of improved treatments for Parkinson's.
That's going to bring us to the end for this edition of CTSI Discovery Radio. As always, thanks to each of our guests for appearing on today's show. Dr. Eric Jakowiak and Dr. Samantha Hutton. I hope you've discovered something by listening to today's show, and I'm doubly hopeful you'll join us again next time. CTSI Discovery Radio airs the third Friday of each month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Reza Shakir.